The House Rules Committee will come to order. Would the clerk please take attendance?
Chair Schutte,
Here.
Representative Zaragoza. Here.
Just barely, but we do. And Representative Martin moves to adopt the minutes of the October 16th meeting. There being no objection, the motion prevails by unanimous consent. We will now take testimony on House Bill 4402. And that is Representative Pohutsky. Yeah. Oh, no, never mind. We'll be hearing testimony on 4930, and Representative Mueller will be testifying. Representative Mueller, please come forward. Yeah, exactly. Very, very similar. Yeah. Did you get tased in committee yesterday? No.
Thank you, Mr. Chairman, members of the committee. This is a pretty straightforward bill. It came from taken from the law report. Currently, under current law, licensees are allowed to use nicknames for licensure, making it hard to hold bad actors accountable. By requiring applicants, licensees to provide their legal name, it will provide for more transparency. And this is specifically directed toward the medical licensures of our medical people that perform surgeries on people. And if you want to make sure that they're doing things to your health and safety. You want to make sure that there's people that when you go to look up a medical professional to get reviews on them or anything like that, they have their name is accurate, so then that way you can hold them accountable. It's basically a small fix, and the substitute, all that does is give Laura 90 days to implement the practices after it's been passed. That's the only thing with the sub.
Well, thank you very much, Representative. Obviously, we've been working with Laura, and this was a recommendation that came from their red tape report. So I appreciate you working on this. I think especially when we're looking to cut red tape, making sure that we have simplified procedures for licensing is important in that streamlining process. So any questions from members of the committee? Representative Martin.
Yeah, you said it was mainly because of the medical fields, but this is going to be across the board for regulatory licensing?
My bill is specifically for the medical licenses. I don't know if there's other bills in the package that deal with licensees from other occupations or not.
So we're gonna look at it for across the board. Yeah. Good, because I got some building licensing type things where people change their name to get a license when they're bad actors. Okay.
Well, that's great. Well, good thing we have Representative Martin on the committee, so that's good. Any other questions for Representative Mueller? All right, yeah, and you survived without any stings today, so there you go. Awesome. All right, well, thank goodness. All right. Okay, now we will be hearing testimony on House Bill 4929, and we'll be hearing from Representative Pavlo. Representative, begin when you're ready, please.
Is this on? Thank you, Mr. Chair, and thank you, committee. Testimony for House Bill 4929. The overreaching purpose of this bill is to relieve unnecessary work within the licensure system for medical licenses. There's currently no way for someone to voluntarily relinquish their license. Someone may want to relinquish their license for the purpose of retirement, career change, or for personal reasons. Relinquishing one's license would reduce unnecessary work within the Department of Licensing and Regulatory Affairs. Laura is required to notify a licensee that their license is going to lapse. If a licensee knows that they don't want to renew their license, voluntarily relinquishing their license would reduce clutter on the books and unnecessary work for the department. The process to voluntarily relinquish one's license is simple according to this bill. The licensee would deliver their certificate of license or registration along with a written notice of intent on a form that's provided by Laura. The license or registration would be considered surrendered on the date the department receives the aforementioned form.
Thank you, Representative. I think, again, when we're looking to cut red tape, making sure that there's a process to relinquish a license, it's kind of incredible that we haven't established it yet, but appreciate your leadership on working to find that. Do we have any questions from members of the committee? Representative DeBoer?
Well, I'm just curious, what are they doing now? Wandering off or?
I think they just keep sending the forms out, and
Yeah.
there's got to be a time when they don't, if they don't renew their license.
Yeah,
It just makes for a lot of extra paperwork, a lot of work for the LARA department, and this would just simplify things, I believe.
I believe you have to wait until your license expires, so that can be, again, a lot of needless, waste there. So, yeah.
Wow. Way to get it done. Thank you.
There you go. All right, thank you, Representative. Any other questions, members of the committee? All right, and now, after a false flag earlier, we'll be hearing testimony on House Bill 4221, and Representative Pohutsky will be testifying. Representative, please come forward and begin when you're ready. Could you hit the mic? There.
Oh,
thank you.
hey, look at that, like I've never been here before. My bill is a companion bill to Representative Aragona's bill, HB 4220, which would allow for veterinary telehealth in the state of Michigan. My bill really just requires LARA to promulgate rules to implement the substantive bill, not trying to get too far stepping on your toes, but the bill would allow for the use of veterinary telehealth medicine.
Step away.
Okay. Veterinary telehealth was allowed during the pandemic, but those emergency rules expired and that flexibility ceased. It was really, really helpful. So these bills would ease regulations in order to increase the access of veterinary medicine to pets who otherwise might not be able to receive it for a variety of reasons. The increased cost of an in-person visit may be prohibitive. There are a lot of shelters that simply do not have the resources to take animals in for a first-time visit with a veterinarian. And also some pets find in-person visits to be really, really troubling, and that exacerbates already ongoing issues. So the legislation allows for the flexibility for veterinarians to use their best judgment regarding whether or not an animal needs an in-person visit. It establishes common sense guardrails to ensure animals are still receiving the best possible care. The bills do not allow for the prescription of controlled substances as a result of a telemedicine visit, to make sure that pet owners aren't taking advantage of these visits to obtain such medication. And again, my bill just allows or requires the department to establish rules that would allow the implementation of Rep. Aragona's bill. Did I miss anything?
Thanks, Representative. So obviously involves rule promulgation. Have you consulted with the department and the Michigan Board of Veterinary Medicine?
We've just consulted with both of them. The department is fine. They have some concerns about the time frame established, but they don't have any issues with the substance of the bills.
Okay.
The Michigan Board of Veterinary Medicine, we're going to hear some veterinarians. Some folks are opposed because they get office fee visits by requiring those. But most veterinarians acknowledge that. I think the most important thing to remember is if people are not bringing their vet or their pets into the vet now, they're not doing it for a reason other than telehealth, right? Allowing folks to bring their vet or have their pets seen by a vet via telemedicine is going to expand access. It's not going to fundamentally change the behavior of people who are already not taking their pets in.
Okay. Good. Representative Aragona, you have a question?
Representative Pohutsky, thank you very much for partnering with me on this. I very much enjoyed partnering with you. I think this is a great bill package, obviously, because I put my name on it. But here in rules, we're looking at the actual promulgation that departments must go through, just to kind of give it a little extra scrutiny. With this and with your bill, wouldn't it be reasonable to say that since we already have telehealth for humans, a lot of the promulgation can even in all likelihood be a little bit of copy paste over to this other form of medicine for animals?
I think that's fair to say. And also, again, this is something we did for a pretty significant chunk of time during the pandemic. This is not uncharted territory. We've already been here before, and so is the department. Thank you.
Representative DeBoer?
Yeah, really, it just makes sense. I mean, it's not really in person, it's in dog or whatever. And a lot of times it's pretty hard to get an animal in. And, you know, you can have a single mom with kids you just got to bed and then the cat's throwing up and, you know, you just can't leave them. And if you could do a telehealth thing, you'd probably take care of the animals even better.
Absolutely. And there's also guidelines in there that if a problem seems to be persistent and any prescription is not taking care of it, then they do have to come in and be seen. And again, there's also discretion for veterinarians to decide telehealth isn't appropriate, we need to see them in person. So there's flexibility in there, but it's really just about expanding access, like you said.
And it has to be a Michigan vet.
Correct.
In the
They have to be
Michigan
licensed in the
telehealth.
state of Michigan.
Yeah, I could see where people would be concerned about someone from another country taking market share and.
Yep,
So-
absolutely. But nope, they have to be licensed in our state, which
So
is
we're
a
caring-
pretty onerous process.
Yeah, caring for our own.
Correct.
Yeah, okay, thank you.
Thank you.
Any other questions, members of the committee? Well, Representative, thank you. And now we will be hearing in support of the bill, Dr. Crystal Sapp from Michigan Humane and Caitlin Stadler from ASPCA. Thanks for coming, and begin when you're ready.
First task accomplished. I turned on the microphone. My name is Dr. Crystal Sapp. I am the Vice President of Veterinary Medicine at Michigan Humane. I'm testifying in support of HB 4221, one of a pair of bills that would allow a veterinarian to provide care to an animal via telehealth without the requirement of an in-person examination of the animal. You have our written testimony, so I will be brief. In addition to our shelters, Michigan Humane operates 3 veterinary clinics in Detroit, Westland, and Rochester Hills that are available to the public. The ability to provide veterinary care to a patient via telehealth who is unable to be brought into one of our clinics for an in-person appointment would be a vital tool in our efforts to meet clients and their pets where they are. Michigan Humane invests significant effort and resources in providing families with the support they need to keep their pets rather than relinquishing them to a shelter. Access to veterinary care is one of the most important services we can provide to help keep pets with their families. In the same way that a physician is able to use telehealth to provide treatment to a human patient he or she has never seen in person, veterinarians should be given the discretion to use telehealth when appropriate without necessitating a prior in-person examination of an animal patient. Telehealth could be used when a client is unable to bring a pet to the clinic to triage the pet's needs, to answer questions a client might have about their pet, and provide discussion-based care in a safe, convenient, and cost-effective way. We saw the benefits of telehealth in veterinary medicine during the COVID-19 pandemic, when veterinarians were allowed to exercise their professional judgment and use telehealth without requiring a prior in-person examination of their animal patients. Telehealth was used without issues to provide access to veterinary care during a time when in-person care was restricted. Many Michiganders, both in cities like Detroit and in rural areas, do not have access to a geographically convenient veterinary office. Even if a veterinarian is geographically accessible, a lack of transportation, a disability, the cost of care, and a long wait for an in-person appointment can create barriers to accessing veterinary care and pose risks to the health of companion animals. These barriers to accessing veterinary care disproportionately impact low-income families, which creates inequity in accessing veterinary services for their pets. There's an obvious limit to the services that can be provided via telehealth. Some types of routine care, such as vaccinations or sterilization, and more complicated medical issues would necessitate an in-person visit. Michigan Humane has other strategies for addressing those needs, such as offering One Health vaccine events in various neighborhoods in Metro Detroit. But the ability to use telehealth as a first step in educating clients, assessing an animal's needs, and developing a plan of care could be an invaluable tool in safely providing much-needed veterinary services in an accessible and affordable way. Thank you so much for your time and attention. I'm happy to answer any questions.
Additional testimony, then we'll have questions. So.
Thank you to Chair Schutte and members of the committee for giving me the opportunity to testify on this bipartisan legislation that would expand access to veterinary care for Michiganders all across our state. My name is Caitlin Stadler. I'm the Legislative Director for the American Society for Prevention of Cruelty to Animals, Great Lakes region. On behalf of our organization's 35,000 members in Michigan, we want to express our strong support for this legislation. Taken together, House Bills 4420 and 4421 would allow Michigan licensed veterinarians to establish a veterinarian-client-patient relationship through telehealth. Current law states that an animal must have been seen by the vet in person before they could do telehealth. Right now, we're facing a very severe shortage of veterinarians throughout the country and within our state. It's estimated that by 2030, 75 million pets may be without care. Research demonstrates that many pets do not regularly see a veterinarian. It's about 1 in 3 that do, often because their families confront significant obstacles and barriers to obtaining veterinary care. Obstacles that may result in pet owners seeking veterinary care. Many Michiganders live in an underserved or urban or rural setting, remote area with few or no veterinary services available. These factors can force families to make difficult decisions to forego basic preventative care as well as urgent medical needs of the pets. As we've seen in the human healthcare field, telehealth can help bridge gaps created by these type of workforce shortages or other barriers to healthcare access. As was mentioned, physicians throughout the country and all 50 states establish new doctor-patient relationships using telemedicine, including for infants and for individuals who may be nonverbal. Telemedicine is proven, safe, and convenient means for delivering care. Michigan's current outdated, unnecessary regulations block licensed veterinarians from using their professional training and judgment to treat animals and further hinders access to veterinary care to Michigan pet owners. While we support the creation of new veterinary schools and programs to help address this shortage, we also know that it will take decades to truly alleviate the negative impacts of the veterinary shortage, whereas expanding access to telemedicine, access to care through telemedicine is something that policymakers can do right now to help this crisis. As Dr. Sapp mentioned, for 3 years during the COVID-19 pandemic, pet owners had this as an option. We heard from many veterinarians about how transformative it was for their practice and for their patients, as well as the disappointment when the directive expired. Under these bills, the vast majority of Michigan's telehealth rules will remain intact. Veterinarians will still be required to identify themselves clearly, protect client privacy, ensuring all technology complies with applicable privacy laws. Veterinarians will still need to use their professional judgment to determine when telehealth is a good option and when it may be appropriate. Veterinarians have to stay within the scope and maintain their standard of care. The bill ensures there will still be follow-up care. The veterinarian who is caring for the animal, if they're unable to do a follow-up in person, they will refer the client to someone who can. And the rules will still require obtaining and documenting consent for both parties. The rules that we would like to see changed would be lifting the requirement that veterinarians see an animal in person first before they treat the animal through telehealth, something Michigan already does for human medicine and what many states already do for veterinary medicine. The second related update is related to prescription authority. The legislation limits the duration of prescriptions for up to 14 days and allows for just one single refill if the veterinarian determines that continued treatment is medically appropriate. It would also prohibit prescriptions for controlled substances when there isn't an in-person visit. Thank you again, Chair Schutte, members of the committee. I appreciate the opportunity to testify on this legislation. I'm happy to answer any questions.
Thank you for your testimony. Any additional questions? Oh, Representative Martin.
Thank you. So just for a little more details, has to be a Michigan licensed veterinarian. You're talking about access for rural areas and homebound people and so forth. And I'm just wondering how this would apply to snowbirds. They take their animal to Florida, can they call back and make an appointment with their established Michigan veterinarian?
I know it is in human telehealth. It isn't. There's certain providers who are,
I mean, it doesn't preclude an out-of-state calling in to Michigan.
it doesn't, there's nothing that precludes a Michigan/Florida resident.
And if the veterinarian determines a prescription is needed, can that be filled out-of-state? Can it be filled at anywhere? Any
Anywhere.
licensed pharmacy?
Yes,
Okay.
yes.
Thank you.
Well, thank you. Any other questions? All right. Appreciate both of your testimony and support of the bill. All right. Additional cards to read in. Not wishing to speak but submitting written testimony in support of the bill is Ann Griffin from the Animal Law section from the State Bar of Michigan. Not wishing to speak in support of the bill is Dr. Barbara Hodges, Humane Society Veterinary and Medical Alliance. Not wishing to speak in support of the bill is Dr. Courtney White from the Humane Society of Huron Valley. Not wishing to speak in support of the bill is Katie Jarl from the Virtual Veterinary Care Association. Not wishing to speak in support of the bill is Dr. Cheryl Good from the Dearborn Family Pet Care. Not wishing to speak in support of the bill is Tanya Hilgendorf from the Michigan Pet Alliance. And not wishing to speak in support of the bill is Mitchell Nelson from the Humane World for Animals. And not wishing to speak in support of the bill is Dr. Amy Nichols from the city of Warren, Michigan. All right, now we will be taking up House Bill 4306, and there is a substitute for House Bill 4306. And this is our bill from Representative VanderWall, which allows for less than 6 month suspensions for drivers who have suffered an epileptic seizure. And under the substitute, in that shorter suspension window, the requirement for notice and hearing is removed, and the substitute retains the possibility to shorten and waive outlined time periods if defined conditions are met. Representative DeBoer moves to adopt the substitute. Would the clerk please call the roll?
A motion to adopt the substitute, Chair Schutte?
Yes.
Representative Zaragona? Wenzel? Martin? Postmus? Boer?
Yes.
Whitwer? Liberati? Hersberg? Mr. Chair, you have 6 yeas, 0 nays, and 2 pass. The motion does prevail.
The substitute is adopted. And Representative DeBoer again moves to report the bill with recommendation as substitute H1. Would the clerk please call the roll?
On the motion to report, Chair Schutte?
Yes.
Representative Zaragona? Wenzel? Martin? Postmus? Boer?
Yes.
Whitwer? Pass. Liberati? Hersberg? Chair, you have 5 yeas, 0 nays, and 3 pass. The motion does prevail.
The bill is reported with recommendation as substitute H1. And next we'll be taking up House Bill 4402, also from Representative VanderWall. And Representative Martin moves to report the bill with recommendation. Would the clerk please call the roll?
On the motion to report, Chair Schutte?
Yes.
Representative Zaragona? Wenzel? Martin? Postmus? DeBoer?
Yes.
Whitwer? Yes. Liberati? Hersberg? Mr. Chair, you have 8 yeas, 0 nays, and 0 pass. The motion does prevail.
The bill is reported with recommendation.